Dear friends, today, Saturday, 25th January 2025, we have finished 1,519 cases of Puberphonia. So this is a very great achievement for us. And today happened to be a Saturday. We have a small program in the name of Puberphonia Eradication Program. Actually, this is arranged by the International Tirukural. So they have done, they want to do a program. 100 places they want to conduct a seminar, a conference itself for Tirukural. So I gladly accepted to have one program at Siva ENT Hospital. Okay, which is actually it is planned by and organized by Professor Dr.M.Kumaresan, who is the president founder for this Tirukural Mahasabha. And the local arrangement for this Puberphonia. And luckily, and we are able to get more number of audience. And there are 10 people who spoke about Tirukural. I had also the opportunity to talk about Tirukural and voice, because a lot of chapters in Tirukural saying about how to use the voice, what is the benefit of having a good voice. So all things are there. I am able to tell them, and we are able to introduce that today we had 4 patients. One patient the therapy and gone, and the other patient what we have done. This is the thing taken 18th January 2025. The study of vocal cord and uvula. See, we are giving from this study itself, you will be able to understand we are giving more importance, more than to the vocal cord, the uvula, the movement of the uvula. We are recording the uvular movements, and we are sorting out what are the things we are recording. This is not one case. 1,519 cases we have recorded all these things. See, the structure and function of the larynx, vocal cord, completely normal. There is no question of any pathology at all. Normal laryngoscope with the finding. But on phonation, vocal cord failed to meet in the midline, and only the edge of the vocal cord vibrate. On phonation, the false vocal cord meets earlier than the true vocal cord. So the impression is a dysphonia plica ventricularis. So it is a case of Puberphonia with lazy vocal cord. So that is the voice become lack of power. This is only due to non-breaking of the voice. So the treatment option is strengthen of the vocal tract. We strengthen the vocal tract by placing a thread in the uvula. We break the voice and get the low pitch from the higher pitch on the first day. But we need habituation for 5 days by abdominal breathing. I have already told you that we are having our own method of treatment for Puberphonia. So the same day, in my presidency, Dr. Lalita Sundaram has released this book about Tiruvalluvar, and many people had submitted their view on voice and Tirukural. So many papers they have presented, and we have formed a a small booklet on the same, and that also we have released. So because this is I have already told you, in treatment of puberphonia, there are three options. See, what we are dealing, all the things is clinical aspects. We have treated 1,519 cases, clinical aspect. There is two other aspects are there. One is called as phonetic aspect, where the phonation is produced. The third option is science and technology. So my work or our work is not finished with clinical aspect. Clinical aspect, I am able to get success in 1,519 cases as on today, 25th January 2025. So I am able to prove. I also intend to have a simplest method of treatment of puberphonia. On seeing my method of treatment, the doctors and friends are telling, this is the very simplest method. What more you want from the simplest method more than this? So I am changing to the second aspect, the phonetic aspect. What happened? Where the moment occurred? What happened? So for that, we had a good chance of telling few doctors. One is Dr. Lalita Sundaram, another is Dr. C. Sidambaram, another is Dr. Gunaselvi, another is Kavinger Ramasamy, another is Saraswati Ramanathan, another is Dr. Indra Iradi Kumari, another is research, but he is not a doctor, but he is able to tell more concentration on puberphonia. He is Mr. Rama Manikam, then Vijay Purani, and what is the problem in the society, Harini, and Dr. Rajasekhar. So they had given me a lot of information, and I am able to follow that and regulated the seminar today morning in my hospital. Today is, today is 25th January 2025. So it had given a lot of impression to me and a lot of awareness. What more I can do? What more I can do? Phonetic aspect. Phonetic aspect, we are more interested in knowing about the what is happening in Tamil literature. Okay, what happened to the Indian literature, Western literature. But along with that, I want to solve the clinical aspect to the doctors and friends. What are the characteristics of secondary sexual characteristic, hair growth, emotions, all the things what happens in puberty. They say the general thing, that's all. So that typically in puberty, boys become deeper. So this is true. That is very significant in young boys. But it is not, if not get deeper, it is becoming a very concerning. This is why I am going on telling of poverty. It is having its own secondary problem. So the whole society does not tend to think twice about the teenage boys, about the high pitch. So what are the psychological trouble these puberphonia boys, high pitched voice are having. So that should be eradicated, definitely. So this is called in fantastic name as a functional falsetto. Definitely, speech therapy is the first order of treatment, but in my feeling, it may take long time. There is no gold standard for treatment for speech therapy. Also, you may say that all speech therapists will treat puberphonia. Yes, I'm happy they are treating. They are doing good job. But think, for example, a case of stammering throughout the world. Thousands of people of stammerings are there. Everybody, ENT surgeon and their colleagues or the paramedical field in speech and voice, they are treating stammering. But there's no great standard in it. Yes, this is a specific treatment, it cure it. So there is no condition at all, in my feeling. But ENT surgeons should accept. So why not ENT surgeon take a upper hand in treating puberphonia? And it is easy for ENT surgeon to treat, and our methods are also very simple. We can treat puberphonia. So this is what I want to tell every day. Yes, puberphonia is classified as a voice disorder. Yes, great. So, but we have to think a lot. What is the other thing already explained in our textbook? We have to change little in our mind. What are the symptoms? So, voice is not changed. That means it is a high pitch voice. Voice frequency is greater than 150 hertz. Because in women it goes from 120 to 210 hertz. And the voice will be breathy and weak voice. That's what I am going on telling. The whole upper vocal tract is lazy. Because of this voice, they will have a hoarse voice, low intensity in their voice, trouble in making your voice louder. They want to make the voice louder, but they are struggling with that. But some people will have a double voice also. So this is the important thing they told in my speech. The other ENT doctors are telling, even for not strong enough, that voice also you are treating. Yes, that is also a type of puberphonia only. They become tired long time, so the meeting and conversation continue for a long time. Their voice become tired. See, voice should come regularly, flowing. But in puberphonia, they require increased effort to speak. And by that effect, the quality is fluctuating. When they fluctuate, there is a tension in the neck muscles. So their sounds will be different. With this character, we feel there are a number of causes for puberphonia. There is no other cause except high pitch voice, which causes physiological, neurological, and biological. So don't put first psychological, neurological, and biological. The puberphonia voice causes the psychological, neurological, and biological. Biological causes, which include tension in the laryngeal muscles, abnormalities of the larynx present from birth, impaired hearing, thyroid cartilage fused in the midline, vocal cord paralysis, lack of muscular coordination, vocal cord polyps, cysts, nodules, trauma to the vocal cord, asymmetry of the vocal cord, inflammation of the larynx. All the things will happen because of puberphonia. So my view is entirely different. The old belief is tension, abnormality in the larynx, hearing impairment, thyroid cartilage deficiency, vocal cord paralysis, lack of muscle coordination, vocal cord polyps, cyst, nodule, trauma to the larynx, asymmetry of the vocal cord, and inflammation of the larynx. These causes puberphonia. This is the old belief. Biological causes. I am telling, puberphonia causes all these problems. So how to make people to understand is a lot of time will take. Anyway, I will be able to succeed. Similarly, neurogenic causes. They say Parkinson's disease, multiple sclerosis, laryngeal nerve paralysis, vocal cord spasm. All these can happen after puberphonia. Because until 17th year, it is until puberty, it is normal. Because of puberphonia, this boy is having pictures like that of Parkinson's disease, multiple sclerosis, laryngeal nerve paralysis, vocal cord spasm. So this created that or that created this. All the neurological cases, Parkinsonism, multiple sclerosis, laryngeal nerve paralysis, vocal cord spasm, all are there, not there before 14th year. Because of puberphonia, these neurological symptoms can occur. Similarly, the psychology is resistant to change with which comes after puberty, stress, emotional stress, chronic stress disorder, depression, anxiety, self-conscious about the voice break. So general conscious with growing puberty. So these psychological problem never cause puberphonia. Puberphonia causes these problems. So definitely speech therapist can help puberphonia to a great extent. But when there a simple method of treatment available with the ENT surgeon, why not they treat it early and make it all right? What I am telling is the structure and function of larynx is normal, vocal cord is normal. Yawning, sighing, coughing can produce high pitch voice to low pitch voice, including snoring. So you can get a low pitch out of high pitch voice within a minute, making them to yawn, cough, sighing, or coughing. So why not you do that? I am doing that. Snoring, that is the easiest method. Make them snore. How they snore is vibration of the vocal cord, vibration of the uvula. So if you are able to control and get them to snore, snoring voice, high pitch voice is turned to low pitch voice, then simply you can treat it. See, other people they say humming, swallowing technique and speaking. all the things I don't know, speech range masking, how to do it, it's a big problem. That's what is the science of treatment of puberphonia is not get very popular. So these are the things are there. Thereby, indirect voice therapy had come. Indirect voice therapy, education on good vocal hygiene, and how certain action could affect the voice, counseling, identifying psychological factors, environment. So all the things had come as indirect voice therapy. Then comes the audio-visual feedback. So these are the good methods speech therapists are following, audio-visual feedback. Along with that, if it all the things fail, then another medical intervention is also there, medical treatment. That is it may be surgery or injection of Botox. Botox injection help to relax the muscles for temporarily only, but the recurrence is absolutely there. So we don't know that we won't have the long-term effect. Every time we have to go on inject it. And surgical option, medical intervention is a good thing. Surgical option is there. Isuki method of thyroplasty. But it's the last resort option when all other forms of therapy fails or unsuccessful. Surgical therapy also help to relax the vocal cord, shorten the vocal cord. Surgery also used to reposition the thyroid cartilage. But we know surgery is always have its own uh, problems. So all these things are going on, suggesting to us what more I can do for puberphonia. So clinical aspect, we are very clear. We are able to get immediate and permanent cure for puberphonia by our method of treatment. So what more we can do? We have to say, uh, see, that are all there in the literature, but it is not workable for puberphonia. Now we are very interested in and treating the language aspect of puberphonia. Thereby we are going little towards ancient literature, Indian literature and Western literature. What are the Euler words? But what happened is in English literature, there is no Euler words at all. So that is the big drawback we are having when we are thinking of treating Euler for whole mechanism of treatment for puberphonia. So when Euler words sounds are not there, what more we can do? That is a very big great thing. But Euler words are there in other languages. Simply in Indian languages, they say there's no Euler words. but I am just hesitate to accept that because some of my uh, Malayalam poets and Tamil poets are telling there are Yular words in Indian literature, mostly Tamil literature. That is and Malayalam also they're having the same thing. So Yular sounds are there. So Yula make sound by touching the back of the tongue. Uvula is just hanging in the posterior part of the mouth behind the soft palate. So uvular sounds are there in few languages. They say French it is there. Uvular sounds are fricative. Voiced uvular sounds are uvular trill. And uvular stops are there. Uvular fricative is there. Uvular nasal is there. So these are the things only available in the literature. But to find out the literature, to learn about these things, which language it is there, where we have to live there, then only we'll be able to understand the deep knowledge of it. It is not so easy by seeing the literature, you'll be able to know more about it. If it is French or Arabic or Hebrew or some other language, you should go there and live. They say African languages are there, Somali language is there, Native American languages. Some mountain people are talking Yular words. Dutch people, some language is there, German, Arabic, Persian. And they say in Punjabi also some Yular sounds are there. So we have to go there and live, because we can say that India also are having a lot of languages, but it is for me as a South Indian very difficult to know more languages. But we have to go there and learn. Then only we can know more about if it is Danish, Swiss, Norwegian, German, Dutch, Hebrew. That we can learn it. Definitely we can. There should be, see, research won't come automatically. You have to work for it. You should try for it. Then only you will get it. It is not a simple process. Nothing is available simple. And some of the words of eularization, that is a secondary articulations are there. And we should know more about international phonetic alphabet. What is the standard symbol they are using for international nomination? So what is the whole thing is there in Arabic, they say. So we have to go and learn Arabic. Then only I should be strong in Yular words, where I can get the place of articulation. where the point of articulation in the vocal tract and the manner of articulation I should learn. What is the manner of articulation and how it is processing. So this is a great work. The phonetic aspect you have to learn. Then the third thing is science and technology. That also I should try. Geometry, what happens, what are the other physical factor. Now science and technology had gone to a great extent in phonetic aspects. So definitely I should learn. Then only I will be able to prove that uvula is a speech organ. Uvula sound, science and technology. I don't know that I will be able to. Yes, I will be able to do it. Definitely. Uvula words. There are science and technology. What happened? Science behind the uvula words. What happened? The whole science of uvular words, uvular consonants, examples of uvular sound, how it is represented. We have to go from very much beginning. But we'll be able to do it in the long run because God also will be with us in helping to know all the things. So many years, somebody is there to help us. Why not now, when everything is matured? Because we have treated 1,519 cases of Puberphonia as on 25th January 2025. So clinically, we are able to get such a huge number of Puberphonia. Today also 3 means. What is this happening? So God is kind enough to give so much of cases. Why not I learn Arabic language and find out what are the uvular words there in Arabic language? Definitely, I will be able to get it, and I will be able to succeed in uh, doing the science and technology. But see, without my knowledge, my paper has been read by so many people. I hope so, because there is a reference in out of ENT or American, Europe, all these places. But I'm so surprised to get reference from Pakistan. Bangladesh, it is very easy. Their boys are coming for treatment. But reference are there from China and Korea. So these people, the science and technology, I hope little China, Korean and Japan, German, the science and technology has increased to a great extent. But in the modern world, everything had become commercialized. That is a very big drawback. Nobody, yes, somebody may do their own interest and help me. Now I am searching for a intraoral camera for the last 6 months. a spy camera which can be attached to the hot palate. I have told so many, more than 10 dental doctors. Today also I met one dental doctor. Can you able to get me a spy camera which can be attached to the denture? So, see, on my request, he had come personally to Royapettah, my clinic, and we have discussion for more than half an hour. He has told lot of many of his friends who are making dentures, but now they are not interested in making dentures at all. Now all are implants. So modernization had come, but still, I hope I will be able to get a spy camera which can be fixed to the denture and take photographs of what is happening, the science and technology in the uvula, science and technology in the nasopharynx, science and technology in the posterior oropharynx, better than that of a vocal cord. So time will come, I'll be able to prove that. So everything, the opportunity is there. So this Saturday, I'm happy that we are able to do two programs. So Dr. Lalita Sundaram, a Tamil program, phonetics, in comparison with the Tirukural. Second thing is we have treated 1,519 cases of Puberphonia as on 25th January 2025. I will try to meet with a new expectation on next Saturday. Thanking you. Great, happy, happy, happy. We'll see you next Saturday.